there is a need for prevention. There is a power in effective prevention. There are plenty of shaken baby syndrome prevention programs out there, but what is most effective method of not only reducing cases, but also supporting and educating families? So in the abusive head trauma in infants and children technical report, they not only discuss new research on shaken baby syndrome, abusive head trauma, but they also mention prevention. So they emphasized the importance of supporting caregivers during early infancy, especially during those high crying periods that we talked about around that 2-month time frame. So they endorse evidence-based programs, which include the mention of the period purple crying program, which we'll talk a little bit more in depth in a minute, and its effectiveness at having positive impacts on parental knowledge of normal infant crying, and also how to cope with the frustration that crying can cause. It's important for prevention programs to include key components, such as education on crying, calming and soothing strategies, the dangers of shaking, and what to do when overwhelmed, and so much more. But there is an importance of having hospital-based interventions. You know, in a perfect world, we would have universal delivery of shaken baby syndrome, abusive head trauma prevention materials in every birthing hospital, just as a part of discharge. But also having system level support where the program and messaging are also embedded into pediatric visits, community programs, home visiting, really anywhere that sees families with children under 1 year of age. But from various studies over the years on crying and infant research and abusive head trauma, we found that abusive head trauma is the only form of child maltreatment where we know the specific trigger, which is increased infant crying, and the timing of the incidents, which is around that peak 2-month time frame. So since we know triggers and timings, it can be prevented. And prevention really starts with educating parents and caregivers about normal infant crying and the frustration this crying can cause. So that's where the Period of Purple Crying program comes in. It is a program of the National Center on Shaken Baby Syndrome. It's based on over 60 years of research. The program itself has been studied for over 18 years. And the program really has two aims, which is to support caregivers in their understanding of early increased infant crying, and of course, to reduce cases of abusive head trauma. So the reason the program is called Purple is that each letter stands for one of the 6 features of crying in normal infants that contribute to the frustration and anger that the caregivers experience. So the first P stands for peak of crying, where the amount of crying infants experience naturally increases, peaks in the 2nd month of life, and then slowly decreases after that. U stands for unexpected, just referring to the fact that these crying bouts begin or end completely unpredictably and for no apparent reason. They're not related to dirty diapers, feeding, or anything else that's going on in the baby's environment. And R stands for resist soothing, when nothing a caregiver tries can calm the baby down. And the second P stands for pain-like face. Sometimes the infant can look like it's in pain even when it's not. L stands for the fact that these bouts are long lasting, averaging about 35 minutes per bout, but they can go on for as long as 5 hours a day or more. And the last letter, E, stands for the fact that the crying tends to cluster in the late afternoon and evening hours, often when the caregivers themselves are most tired and frustrated. But we then preface the acronym with the word period, just to remind caregivers that the crying does not go on forever, but only for a particular time period in the infant's life. So the real purpose of the Purple acronym is just to provide a quick, memorable, and easy way for caregivers to recognize and acknowledge that these crying characteristics can happen and they are completely normal. And while the acronym prepares parents for the crying characteristics, our crying curve prepares them for the timeline. So we know one of the biggest stressors for parents is the normal period of increased crying that all healthy babies experience. And so it's great for them to understand that the crying starts to increase at 2 weeks. It'll peak during the 2nd month. and then slowly decrease after that. So it's important for them to know that the crying will come to an end. So what does the program information education look like? What are these newborn families receiving? So it comes in an app and booklet package. It contains a 10-page booklet, a unique one-time app activation code, and a parent reminder card. So parents are encouraged to download the app and set up an account by entering in the code and then choosing a login method. But they can also invite up to 5 other caregivers of their baby to access their profile on their own devices, just by a click of a button in the app. So this can include partners, babysitters, grandma, grandpa, really anyone who would be caring for their baby. And the mobile app talks about multiple different topics that are very important for these families to understand. So obviously we go through crying, but we also talk about soothing techniques, ways to cope with the crying, general infant safety, how to prepare your home for not only an infant, for toddlers. We go through safe sleep and even self-care for parents, because we know that they need all the support they can get during this phase in their infant's life. But the mobile app is currently in English or Spanish with closed captioning available. And while the mobile app is only available in those 2 languages currently, the booklet is translated into several other languages. And this includes French, Arabic, Haitian Creole, Somali, and hopefully some more to come. But so to ensure all parents and temporary caregivers receive and understand the Period Purple Crying program messages, the program encourages a 3-dose exposure approach. So to teach, reinforce, and advocate. So this helps ensure that all parents and temporary caregivers receive these critical messages, but also promotes a cultural shift in the way that the community views infant crying. So dose 1 is really the first initial education session where parents receive their materials. They receive an education through a trained provider, typically in hospital discharge, prenatal classes, home visiting, really anyone who would see them before 2 weeks old. Dose 2 is a reinforcement session. So parents are reminded of the information they already received. And if they haven't received the information, it's kind of a catch-all dose, so they can give them their program materials then as well. That's usually done around 2 weeks to 3 months after the baby's birth, and it's usually home visiting, pediatric visits, public or state or any other community programs that would see families after that time frame. And then dose 3 is just general population, so social media, flyers, anything like that. But the best thing about this program is it can effectively be delivered in as little as 3 minutes. But it's important to have multiple organizations and programs within the community to deliver the same education. So all families can receive this initial information as well as reinforcement of key messages. So the Period of Purple Crying program has been tested for over 15 years, and it has been shown to be effective. So it is recognized as an effective resource for organizations serving families under 1 year of age through multiple reputable organizations. So just one of them is the California Evidence-Based Clearinghouse for Child Welfare. It's a nationally recognized database that's driven to advance the effective implementation of evidence-based practices for children and families. And really, it's designed to prevent abuse and neglect from occurring. And currently, Purple is the only abusive head trauma prevention program within the database that has research supporting its effectiveness at reducing cases. But so I'm just going to quickly go through these next 2 slides. It's just a timeline of the program and the evidence backing the model. As I said, the program's been studied for over 18 years. The program materials were made public in 2007. 2 years after they were made public, there was 2 parallel randomized control trials, and they showed that there was a change in knowledge and behavior related to the Purple program. In 2014, a study was conducted in North Carolina, and it found that parents reporting shaking as an appropriate form of discipline was reduced by 50% with the Purple intervention. And in 2015, Purple was found to decrease emergency department visits for complaints of crying unrelated to physical illness by 29%, which actually led to hospital cost savings of 18%. In 2018, one of the most important studies supporting the program was published. It was an 8-year outcome of implementation study, and it revealed that the Purple program was associated with a 35% reduction in abusive head trauma in children under 2 years old. Following this article, a cost effectiveness study was published, and it found that every dollar spent on Purple had an associated $54 savings by society, which you can compare to child safety seat loss. For every $1 spent, 42 is saved, and even zero tolerance, where every $1 is spent, $25 is saved. Additionally, in 2021, a study was conducted on Hispanic mothers, and it found that their knowledge of normal infant crying patterns was improved through the delivery of Purple. And one of our latest studies, published in December of 23, found that hospitalization rates for general physical abuse in children under 2 years of age decreased by 30% in British Columbia after Purple was universally implemented. And I think we do have a Purple fact sheet that they will be dropping in the chat if they haven't already. And if not, it'll be in the follow-up email.
It's in there.
Perfect. Okay, so a study conducted on home visiting programs and the components that produce positive impacts on the program's effectiveness showed that the 3 most significant components in improving a home visiting program's effectiveness should include focus on improving parental expectations of the child and parenthood in general, targeting parental responsiveness or sensitivity to a child's needs, and video-based feedback. And the Period Purple Crying program involves all 3 components. So some of you may be thinking that this is great information, but why do you have to buy the program? So the program does come in that app and booklet. It is $2.50 per copy, so it does have a price. And so some of you may be wondering why you have to buy the program. Why can't you just talk about, the crying curve or the acronym? But it's because not only is the program model research and evidence-based, but the use of the materials were tested in an 8-year study. And it was found that both mothers and fathers were found to increase the use of these materials during that high crying period at home, which was around that 2 months after delivery. So mothers' use of the materials more than doubled at home post-discharge, and 50% of fathers had read and viewed the materials by the 2-month mark. So that's why it's extremely important parents and caregivers have their own set of materials at home with them so they can review the information later, as well as share it with other caregivers of their baby. And although the program and prevention has a cost, it has shown to be very cost effective. So large financial costs are associated with abusive head trauma, and even a mildly effective case can cost over $1 million. So one major benefit to implementing Purple is it actually shows potential cost savings to not only the medical system, but to society. So to help your understanding of the cost of abusive head trauma, this graphic is specific to California. So the red line shows the average lifetime cost of a surviving victim, which costs well over $2 million to society. The gray line shows the cost of medical care alone for one severely injured victim from 2 months to 17 years of age. It was around $260,000, but half of that was paid out of pocket by the family. And now the purple line shows the cost to provide Purple program materials to every family with a newborn in California. And as you can see, preventing just one abusive head trauma case can pay for prevention and shows that it's very cost effective.